Hello, everyone, and welcome to Question Lab. We're happy to have you here today as we dissect 4 questions on the topic of immunology. Leading tonight's discussion is Paras, who will introduce himself to you shortly. My name is Sean. I've been with ScholarRx for a little over 3 years now, working with students just like you to help you accomplish your goals via one-on-one tutoring and coaching with our coaches. And leading tonight's discussion, as always, is Dr. Paras Vakaria, and he is going to introduce himself to you now.
Thank you, guys. Thank you, Sean. Hey, guys, my name is Paras. I'm a current dermatology resident here in Dallas, Texas, and I'm also an RX coach with USMLE-Rx. So I work one-on-one with students such as you guys to help prepare you all for the USMLE Step 1 and Step 2 CK as well, and I'm happy to help lead tonight's session.
Excellent. We're happy to have you here as well. So I know we mentioned RX Coach earlier. RX Coach is our tutoring and coaching program. We'll talk more about that later. But for now, what I want you to know is that the methodology that we will use as we dissect these 4 questions this evening is going to be similar to the methodology we use in RX Coach. So with that, let's go ahead and begin with our first question of the evening on the topic of immunology. As you can see, the answer choices are covered up. That is by design. We do that because we don't want you to be jaded by the answer choices. We don't want the answer choices to guide or dictate your thought process. And we don't want you to see an answer choice that you're unfamiliar with that may cause you to panic as you're trying to answer the question on test day. So I've gone ahead and removed those answer choices. After that, we like to begin with the lead-in, which is the last sentence or the question itself. And the reason we do that is because we want you to know what the test writer is asking prior to reading that vignette, so you can pick up on all those relevant clues and prevent yourself from having to waste time and reread that question on test day. So with that, let's go ahead and begin with our lead-in. Which of the following pairs best represents the blood types for donor and recipient? Which of the following pairs best represents the blood types for donor and recipient? We'll give all of you a few moments here to respond in the question box and let us know how many steps you think this question will require. An example of a 1-step question could be where you're asked for the diagnosis. An example of a 2-step question is when you're asked for the treatment for a diagnosis. And an example of a 3-step question is when you're asked for the mechanism of action for a treatment for a diagnosis. So we'll give all of you a few seconds here to respond in the question box and let us know how many steps you think this question will require. The question box is located in your GoToWebinar control panel. I see some responses coming in. Let's take a look at that vignette. In preparation for a blood transfusion, ABO testing on whole blood from an uncharacterized donor and recipient is performed. In the 5 trials, the antibodies anti-A, anti-B, anti-D, or RBCs A or B type are added separately to whole blood samples from a control B positive subject, the donor and the recipient. Each whole blood sample is then observed for the presence of agglutination after addition of the antibodies. The results are shown in the chart. Which of the following pairs best represents the blood types for donor and recipient? Paras.
Thank you, Sean. So what we're going to do is we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in, okay? And so starting off, when Sean first read this question, we kind of got a sense of what this question was asking. So, this isn't your typical classic clinical vignette where you're given a age and sex of a patient and told why they're coming to the doctor. This is kind of more so like a research project or a research study. So you definitely want to make note of those clues that are going to help you come to the answer. It's almost going to be kind of like a puzzle, okay? And in this situation, you want to take note really of what are those important clues that they're getting at. In this case, they're talking about ABO testing, okay? So we know this is really about blood typing, okay? And then you want to really make sure you understand the experiment. You want to understand what's being added where, what are the control groups, what are the subjects, what's being studied. Those are all things that you want to make sure you understand when you try to answer this question. Okay, and this question is specifically asking us about a pair that best represents the blood type of the donor and recipient. So we want to make sure that we understand those 5 trials there in that image. Okay. And on the next slide, we actually have a little bit of a blow up of that image, so you can see. Make sure that you can read the text there. So make sure you're getting a good look at this. And once again, you can see agglutination is the peppered one. No agglutination is clear. And then you have the 3 columns of B+, donor, and recipient. Okay. So we'll move on to the next slide, and don't worry, this image will still be there. And I'm going to go ahead and read those answer choices of those pairs. Okay. And when we work with students, we actually recommend that when they go through the answer choices, that they actually start at the bottom and work their way up to the top. So start with the answer choice E and work your way up to answer choice A. And the reason we recommend this is because a lot of times we'll see students who start at the top, they'll see something they like and select it without having gone through all the choices. So sometimes they'll get that question wrong. And so this way, starting at the bottom and working your way up to the top, prevents you from making that mistake and prevents you from biasing yourself. So let's go ahead and let's do that now. O negative donor and A positive recipient. D, O positive donor and B negative recipient. C, AB positive donor and B negative recipient. B, AB negative donor and A positive recipient. And A positive donor and O negative recipient. So we're going to stay on this slide for just a little bit longer so you guys can look at those answer choices and then look back at that graphic. Okay. So we'll give you guys a few seconds to do that. And then after a few seconds, we'll open up that poll and have you guys select what you think is the best pair.
Excellent. Thank you, Paris. We'll give all of you a few more seconds, like Paris said. And we'll open up that poll. I'll give you about 5 more seconds here to take a look. All right. Hopefully you've had a good look at it. I'm going to launch this poll and wait for your answers. So once again, we'll wait until about 2/3 of you have responded. Remember that there is no penalty for guessing on test day, and certainly not tonight. So never leave a question blank on test day. If you're unsure, just take your best guess. And if you're unsure tonight, don't worry. We're all here to learn together. Take your best guess, and Paris will explain everything to us in just a moment. I see the responses coming in. We'll give all of you a few more moments here. All right. Over half of you have responded. I'll give all of you a couple more seconds here. As always, we do want you to review the correct and incorrect answer choices, and we'll do that here tonight as well. So let's take a look and see what you selected. Looks like 41% of you selected E, O negative donor and A positive recipient. In second place, we had O positive donor and B negative recipient. So let's take a look and see what the correct answer is. And the correct answer is E, and 41% of you got it right. So great job. Let me hand it off to Paris.
Thank you, Sean. Yes, great job. And this is one of those nice scientific questions where you definitely want to make sure, like we said, you understand what they're asking, you understand the experiment, okay? So in this question, you can see that they gave us essentially 5 clues in those 5 trials for us to figure out what is the donor and the recipient, okay? Now, the correct pair here, like we said, is an O negative donor and an A positive recipient. And the reason we came to that conclusion is the donor's red blood cells do not agglutinate with either anti-A or anti-B antibodies. Okay, so that means the donor blood type must be type O. However, the fact that the donor serum agglutinates both A cells and B cells confirms this, because type O serum contains both anti-A and anti-B antibodies, okay? By similar reasoning, the recipient must be blood type A, okay? Anti-D-agglutination means that the RBCs in the sample have the Rh antigen, which means the donor is Rh negative and the recipient is Rh positive, okay? So donor and recipient blood, whenever you're giving that, they should always be cross-matched because you want to avoid any transfusion reactions. So if we take a look at the next slide, this is kind of showing us our ABO classification as well as positive and negative, your Rh classification, okay? So it's important to know based off what blood type you are, whether it's A, B, AB, or blood type O, what that means in terms of which antigens are expressed on the red blood cell and which antibodies are in your plasma, okay? So if you are type A blood type, that means you have A antigen on your red blood cells. So that means you have antibodies against B antigen. So you would not want to be transfused with a patient who has red blood cells with B antigen, because then your antibodies against the B antigen will lyse those cells, okay? So if we go back to our question, hopefully you guys can see why that's the best answer here. We can say for certain that this is an O negative donor, okay? Answer choice D, O positive donor and B negative recipient. In this case, the anti-D agglutination is negative in the donor, so we know that the donor must be Rh negative, okay? So it cannot be D. Answer choice C, AB positive donor and B negative recipient. Anti-A and anti-B antibodies do not agglutinate the donor red blood cells, okay? AB negative donor and A positive recipient, neither anti-A nor anti-B antibodies agglutinated the donor red blood cells, so that's not correct. And then lastly, A positive donor with an O negative recipient. If the A antigen were present on the donor's red blood cells, the blood cells would agglutinate in the presence of anti-A antibody. So we know that's not correct. So nice job here with this question. A lot of moving parts and pieces, but I'm glad you guys were able to piece it together.
Well, thank you very much, Paras. Great job, everyone. Let's move on now to our second question of the evening. As always, the answer choices are covered up, and we'll begin with the lead-in. Which of the following clinical findings are most typical in patients with this mutation? Which of the following clinical findings are most typical in patients with this mutation? As always, we'll give all of you a few moments here to respond in the question box and let us know how many steps you believe the question will require. Then we'll move on to the lead-in, move on rather to the vignette. All right, I see some responses coming in. We'll give all of you a few more seconds. Great, let's take a look at that vignette. A 3-year-old boy is admitted to the hospital with Aspergillus pneumonia. Immunodeficiency evaluation reveals a mutation in the gene coding for GP91 or PHOX. Which of the following clinical findings are most typical in patients with this mutation? Paras.
Thank you, Sean. So once again, we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in. So starting off, now we have a little bit more of a clinical scenario. So a 3-year-old boy, so pediatric case. So definitely important when we're trying to figure out what could be going on with this patient in this case. They tell us why he's admitted to the hospital. And that's usually one of the first things they tell us. You know, why are they seeing the doctor? Why are they here at the hospital? And in this case, it's because of Aspergillus pneumonia. So we definitely want to make note of that. It's not a very common type of pneumonia. Now they tell us the very next step that there is an immunodeficiency mutation. And specifically, they tell us the gene. Okay, so a few clues there that can tell us what's going on in this question. And this question is then asking us about clinical findings most typical in patients with this mutation. So I think we've got a couple steps here. I think one, based off that mutation, we've got to figure out what's going on in this patient, what's the condition, the syndrome, and then based off that, what are the clinical findings most typical in those patients? So I think we've got a nice two-step question here. So once again, we're going to go ahead and take a look at those answer choices. Once again, we're going to start at the bottom and we're going to work our way up to the top. Answer choice E, retained primary teeth, coarse facies and hyperflexibility. D, recurrent infections, eczema, and small platelets. C, periodontitis, easy bruising, and albinism. B, lymphadenitis, liver abscess, and granulomas in the GI or gastrointestinal and urinary tract. And A, abnormal facies, congenital heart defects, and hypoparathyroidism. So we're going to go ahead and open up the poll. Go ahead and select the answer choice you think is the best answer there. And we'll talk about it in just a few seconds.
Excellent. Thank you, Paris. I'm going to go ahead and read these answer choices to you. E is retained primary teeth, coarse facies, and hyperflexibility. D is recurrent infections, eczema, and small platelets. C is periodontitis, easy bruising, and albinism. B, lymphadenitis, liver abscess, and granulomas in the gastrointestinal and urinary tract. And A, abnormal facies, congenital heart defects, and hypoparathyroidism. So we'll give all of you a few more moments here to respond before we go over the correct and incorrect answer choices. Once again, answer choice B is lymphadenitis, liver abscess, and granulomas in the gastrointestinal and urinary tract. And A is abnormal facies, congenital heart defects, and hypoparathyroidism. Let's go ahead and take a look and see what you selected. 46% of you selected answer choice D, which is recurrent infections, eczema, and small platelets. And A was in second place. So let's take a look and see what the correct answer is. And the correct answer is B, lymphadenitis, liver abscess, and granulomas in the gastrointestinal and urinary tract. And 22% of you got it right. So definitely a tough question. Let me hand it off to Boris.
Thank you, Sean. So once again, we're going to go ahead and kind of walk you guys through this question. So definitely a tough question here, okay? So what's going on in this patient? Well, this patient most likely has chronic granulomatous disease, okay? And this is caused by a mutation in the gene coding for NADPH oxidase, okay? This enzyme is responsible for the respiratory burst that produces superoxide for molecular oxygen, okay? Now, it's CGD, or chronic granulomatous disease, is caused by mutations in any of the genes that encode the components of NADPH oxidase, okay? And that include your PHOX subunits, or FOX subunits, okay? If we take a look at the next slide, this is kind of telling us a little bit more about chronic granulomatous disease. It might still be on the poll slide for me. This is looking at chronic granulomatous disease. So this is a defect of NADPH oxidase, and you can see there how a decreased reactive oxygen species and reactive respiratory burst in neutrophils is the defect here. So you're susceptible to catalase positive organisms, okay? And one of the things you can get is recurrent infections and granulomas, okay? And one of the things that they really have started asking are some of those details about these immunodeficiencies, such as the FOX subunits being a component of chronic granulomatous disease. So if we go back to our question, you can see there that this is most likely what they're getting at, chronic granulomatous disease, if you now knowing that information, okay? If we take a look at the other answer choices, answer choice E, this is getting at autosomal dominant hyper IgE syndrome, okay? And that's a mutation in the STAT3 gene. So one of the other ways you could have maybe worked out this question is if you knew what the other answer choices were, what those conditions were and what the mutation was, and you could have known that it was not this one, okay? Answer choice D is getting at Wiskott-Aldrich syndrome, okay? And this is a mutation in the WAS or WAS protein. Answer choice C is Chidiac-Higashi syndrome, which is a lysosomal storage disorder with mutations in LYST. And lastly, answer choice A, that is DeGeorge syndrome, which is due to a deletion of chromosome 2211. So a tough question here, but hopefully you guys are able to pick up on some important clues on how to approach this question.
Excellent. Thank you very much, Boris. You know, we've had some tough questions today, and if you're one of those medical students, like many others, who's, you know, debating what you should do to really get the maximum potential and reach your maximum potential, you know, consider hiring a coach or a tutor. You know, a lot of students come to us and say, oh, my friend said to do this, or I read on Reddit that I should do this. And, you know, what works for one person may not necessarily work for you. And that's because everyone is really different, right? We learn differently, we think differently, we have different strengths, we have different weaknesses. We process and retain and apply information differently as well. So with a coach or a tutor, what you're going to get is an individual and personalized study plan that's focused on you and unique to you, right? So if you're in medical school, we'll use your syllabus and learning objectives to make that plan for you. If you're studying for a comprehensive shelf or for the USMLE itself, we'll administer one of our assessments and base your study plan on that. We are one of the only tutoring companies out there that was in medical education prior to getting into tutoring, and we've actually authored our own resources. Our founders authored First Aid for the USMLE. They authored USMLE-Rx, which includes our question bank QMax, RX bricks, our express videos, and flash facts, which you'll get access to. So because of all of that experience, we have a lot of data and can make your studying much more efficient. And you'll work with one of our coaches, just like Boris, or one of our many other highly trained and certified tutors. And as you can see, all of our students are extremely happy right now. And we even have one student who went through our program as a student and then became an RX coach. So we encourage you, you know, if you're doing great and you want to do better, or if you're not doing as well as you want to do, reach out to us at rx-coach.com. We're here to help. You can click on the free consultation tab at rx-coach.com, and that consultation will speak about the program and how it can benefit you to see if it's a good fit. So once again, that website is rx-coach.com. Let's move on now to our third question of the evening. As always, we will begin with the lead-in. Which of the following is the target of the autoantibodies that are most likely elevated in this patient? Which of the following is the target of the autoantibodies that are most likely elevated in this patient? Once again, I'll give all of you a few more moments here, a few seconds here to respond in the question box and let us know how many steps you think this question will require, and then we'll move on to the vignette. All right, I see some responses coming in. Let's take a look at that vignette. A 53-year-old man presents to the clinic with shortness of breath and wheezing of 2 days duration. Over the past 2 years, he has had multiple hospital admissions for poorly controlled asthma. Additional medical history includes allergic rhinitis and chronic sinusitis. On physical examination, he has wheezing across the posterior lung fields. In addition, there are palpable purpura distributed over his shins bilaterally and over the right elbow. Neurologic examination reveals weak ankle dorsiflexion on the right side. The blood eosinophil count is 1600, and you see the normal range there is 30 to 500. Which of the following is the target of the antibodies that are most likely elevated in this patient? Boris.
Thank you, Sean. So once again, we're going to go ahead and show you what we think are the important clues in this question and the vignette. Okay, so now we've got a 53-year-old male, okay, and he's coming because of shortness of breath and wheezing. Okay, so you want to make note of that. Now this question also gives us a little bit of duration, a little bit of chronicity. They tell us this has been going on for 2 days, okay, so a little bit acute. but they do tell us something more chronic. Over the past 2 years, he has had admissions for poorly controlled asthma. So we get some nice medical history there. And even the next sentence gives us some more medical history. So you wonder, why are they giving us all these things about asthma, allergic rhinitis, sinusitis, okay? Now, they then go on to give us some physical exam findings, some things that are definitely abnormal, okay? So you definitely want to make note of those, and we're going to have to try to piece this together, okay? Now, this question is asking us about the target of autoantibodies most likely elevated in this patient, okay? So I think we've got a couple steps here. I think one, we've got to figure out what's going on in this patient, okay? What's the condition? What's the syndrome? Two, what autoantibodies are involved in that condition? And three, what is the target of those autoantibodies? So I think we might actually have a 3-step question here. So we want to make sure we're getting all those steps right. So let's go ahead and let's take a look at the answer choices. Once again, we're going to start at the bottom and work our way up to the top. E, neutrophils. D, glutamic acid decarboxylase 1. C, erythrocytes. B, contents of the cell nucleus. And A, acetylcholine receptors. So once again, we're going to go ahead and open up that poll. Go ahead and select what you think is the best answer here, and we'll talk about it in just a few seconds.
Excellent. Thank you, Paris. The poll is open. For those of you wondering, next week's topic is pathology. We hope to see you here. And tomorrow night, we have our Path to Success with USMLE webinar with Dr. Tao Lee, and we hope you'll join us. See the responses coming in. There seems to be a clear favorite. We'll give all of you a few more moments here. If you check your chat box, you'll also see a link for a free study planner to register for tomorrow's webinar. All right, a couple more seconds here. Let's take a look and see what you selected. 41% of you selected neutrophils, and second place was tied between B and D. Let's take a look and see what the correct answer is. And the correct answer is E, neutrophils. And once again, 41% of you got it right. So great job. Let me hand it off to Paris.
Thank you, Sean. Yes, great job with this question, guys. So let's take a look at what's going on here, okay? So this patient has numbness, has tingling. We're also told about a lot of sinusitis, asthma, and eosinophilia, okay? All of this in the setting of palpable purpura as well. So we want to think about a vasculitis, a small vessel vasculitis, okay? Such as our ANCA vasculitides, okay? Now in this case, if there were to be one, we would want to think about eosinophilic granulomatosis with polyangiitis, or EGPA, okay? If we take a look at the next slide, this is talking about a little bit of information on that, okay? So asthma, sinusitis, like our patient, purpura, neuropathy, like our patient, okay? And this is a P-ANCA vasculitides, okay? So we'll talk about that in just a second. P-ANCA versus C-ANCA, okay? So if we go back to our question, hopefully you guys can see how this patient kind of fits with that, okay? And as we talked about, this patient has, this disease is P-ANCA, meaning it's perinuclear ANCA. What does ANCA mean? A lot of times we don't even stop to ask ourselves, what do those long abbreviations even mean? ANCA is anti-neutrophil cytoplasmic antibodies, okay? Anti-neutrophil cytoplasmic antibodies. Those are ANCAs. You can have P-ANCAs, you can have C-ANCAs, C meaning cytoplasmic, as opposed to P, which is perinuclear, okay? But all of those indicating that these are anti-neutrophil antibodies. So that is the target of the autoantibodies in this condition, okay? The other answer choices here, glutamic acid decarboxylase, that's present in type 1 diabetes, erythrocytes in a few conditions such as like if you were a patient were to present with pallor and hemoglobin in their urine. Okay, contents of the cell nucleus, that would be something like other autoimmune diseases like rheumatoid arthritis, lupus, when we're talking about anti-nuclear antibodies. Okay, and then lastly, answer choice A, acetylcholine receptors. That would be a target in myasthenia gravis. Okay, so we had a few important steps here. We had one, to come up with the diagnosis of a not very common diagnosis, and then two, realize exactly what ANCAs are talking about. So don't forget to make sure you look up those different things in all the questions. So great job on this question.
Excellent. Thank you, Paros. Let's move on now to our last question of the evening. Let's try to finish strong. We'll begin, as always, with the lead-in. So here we go. A mutation in which of the following genes is most likely contributing to this patient's pneumonia? A mutation in which of the following genes is most likely contributing to this patient's pneumonia? We'll give all of you a few seconds here to respond in the question box and let us know how many steps you think this question will require. And we'll read that vignette. All right, let's see some responses here. So let's take a look at that vignette. A 3-year-old boy is admitted to the pediatric intensive care unit for pneumonia due to atypical non-tuberculous acid-fast bacilli. His identical twin has had similar hospital admissions and also had mucocutaneous candida infections and severe salmonella enteritis. Both parents are healthy, as is his 4-year-old sister. His complete blood cell count, the number of B cells, T cell subsets, and natural killer cells, and immunoglobulin levels of all antibody classes are normal. A mutation in which of the following genes is most likely contributing to this patient's pneumonia? Paros.
Thank you, Sean. So once again, we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in. And so starting off, now we have a 3-year-old boy, okay? And he's admitted to the PICU for pneumonia. And they tell us specifically for atypical non-tuberculosis acid-fast bacilli, okay? They tell us a little bit about family history, other infections the family has had, and then also some hematology and immunology lab work, okay? So hopefully now, as we've gone through this 4th question and kind of showed you what we think are the important clues, you guys are also kind of getting a sense of, in these immuno questions, what do we need to be picking up on, okay? Now they're asking us about a mutation in a gene that's most likely contributing to the pneumonia. So I think we've got a couple steps here. I think one, we've got to figure out what's going on in this patient based on the whole vignette. And then 2, what is the gene mutation in that condition or syndrome, okay? So I think a nice 2-step question here. So let's go ahead and let's take a look at those answer choices now. Answer choice E, STAT3, D, IL-12 receptor, C, CD18, B, Bruton tyrosine kinase, and A, adenosine deaminase. So we're going to go ahead and open up that poll. Go ahead and select what you think is the best answer here, and we'll talk about it in just a few seconds.
All right, well, the poll is open. This is our last question of the evening, so let's try to finish strong. And then afterwards, we will have our raffle and special offer. See the responses coming in. We'll give all of you a few more moments here. Once again, a reminder that next week's topic is pathology, and we'll hope you'll join us. All right. Over half of you have responded. We'll give all of you a few more moments here. And let's take a look and see what you selected. 30% of you selected A, adenosine deaminase, and 28% of you selected IL-12 receptor. Let's take a look and see what the correct answer is. The correct answer is D, IL-12 receptor, and 28% of you got it right. So definitely another challenging question. let me hand it off to Forrest.
Thank you, Sean. So once again, I'm going to go ahead and show you guys what we ended up coming up with this question. And it's a tough question here, so let's take a look, okay? So you can see here we've got a 3-year-old boy, and he's got an atypical mycobacterial infection, okay, acid-fast bacilli. And his identical twin also had similar admissions, but also had Candida and Salmonella, okay? So maybe some immune deficiency going on. Well, if we take a look at the next slide, one of those immunodeficiencies that involves mycobacterial and fungal infections is an IL-12 receptor deficiency. It's a T-cell disorder, and it's due to a decreased Th1 response, okay? It's an autosomal recessive condition, so that makes sense that the parents are healthy, okay? And you can also see here that it's the most common cause of susceptibility to mycobacterial diseases, which is why both of those twins had mycobacterial diseases, okay? Nothing about abnormal B cell levels, T cell levels, NK levels, immunoglobulin levels. Everything's normal here except for decreased interferon gamma levels, okay? So if we go back to our question now, hopefully you guys can see based off that infection history, the family history, how this is probably the best answer, okay? Now the other answer choice, the STAT3 mutation, again, that's a cause of hyper IgE syndrome, okay? So you have high levels of IgE, which we are told the immunoglobulin levels are all normal. CD18, that causes leukocyte adhesion deficiency, which is where you have a high neutrophil count. We're told that this patient's CBC or complete blood cell count is normal, so unlikely to be that. Bruton tyrosine kinase mutation leads to X-linked A-gamma globulinemia, so decreased immunoglobulins of all types, so probably not that. And then lastly, adenosine deaminase. This is one of the causes of SCID, or severe combined immunodeficiency, which is where you have an absence of lymphocytes and immunoglobulins are decreased, so probably not the best answer there as well. So hopefully you guys are able to pick up on what you need to look for and those clues to pick up on those immunodeficiencies and other immunology questions. Great job on tonight's questions. I will pass it back to you, Sean.
Well, thank you very much, Bars. Great job. I know we had some challenging questions today. If you want to review these questions in more depth, make note of these QIDs. Just simply take a picture or write them down. You can log in USMLE-Rx, type it into the search field, and it'll pull that question right up for you. So I'll leave it up for a few more seconds.